Hello everyone, I'm Dr. Ghanee. I am an oral pathologist. Today I'm going to talk about cysts in the oral cavity. What is a cyst? I'm sure you have seen it. Cyst is a sac-like structure filled with fluid. We can have a scalp cyst, ovarian cyst, bone cyst, joint cyst. Even we can have cysts in the oral cavity. We don't know exactly why we develop cysts, but trauma can be a factor. In the oral cavity, cysts usually they have this purple bluish hue, as you can see here, one on the palate and one on the gingiva. There are some cysts in the oral cavity that we remove, we put it under the microscope. They have a specific features of a specific cyst with a name, but some cysts are just a cyst. We see a cyst lining under the microscope and we call them cysts of undetermined origin. This is the same patient after I removed the cyst. As you can see, the biopsy site is healing. Sometimes cysts can occur on the floor of the mouth. As you can see, this is ventral tongue, these are teeth, and there is a huge cyst on ventral tongue. These cysts are harder to remove and the recurrence rate is higher when it is on floor of the mouth. And this is another cyst on floor of the mouth underneath the tongue. This is underneath the tongue and you can see this huge cyst occurring right here. We have another cyst in the oral cavity called eruption cyst. Very often when a 5-year-old, 6-year-old is in process of getting a permanent molar back there, the area is bluish purplish color. Many times parents, they bring the child to me, they're worried, what is that? Basically, again, we see that color suggestive of a cyst. We call this eruption cyst. Usually we don't do anything. The permanent tooth gradually comes down and the cyst goes away gradually and the tooth erupts. Very rarely, if it stays and is persistent, we do a small surgery and we rupture the cyst for the patient. This is another eruption cyst. As you can see, this child with braces, there is a cyst there. This one is not bluish purplish color because sometimes long-lasting cysts, they get infected, and this was an eruption cyst that was infected. I had to rupture this and drain it, and then after 3 weeks, as you can see, the area has healed and the permanent tooth is coming down. There's more about cysts. I'm going to put more videos about cysts, but these were basic things and common cysts in the oral cavity in soft tissue. Thank you so much for watching.